Okay, now we move on to the postural drainage techniques, in which the first one is upper lobe apical postural drainage. The therapist places his or her hand on the clavicle below the neck and the shoulders, and you give the percussions. Like this for at least 5 minutes. Now we move on to the upper posterior lobe, in which the patient is in the semi-fowler position with his head down on the table, and the therapist places his or her hand on the medial side of the scapula, and you give the percussions for the same duration, that is 5 minutes. Now this is upper anterior lobe, in which the patient is in the supine lying position with his hands or arms resting on the side. You can see. Now we give the percussion just below the clavicles on the anterior chest wall. Now we move on to the middle lobe, that is right middle lobe, in which the patient is 1/4 side lying supine position and the head is 15 to 30 degree down. I can't really show the head. And the percussion site for this one is on the right chest wall between the axilla and the nipple. You give it the percussion over here. Next one is the left lingula, in which the patient is in the supine lying position with his head 15 to 30 degree down, and the percussion site for this one is the left chest wall between the axilla and the nipple. You give the percussions over here. Next we move on to the anterior lower lobe basal, in which the patient position is supine lying and the knees are flexed. For comfort, there are 2 pillows below the abdomen or the hip, and the percussion site for this one is over the lower ribs on the anterior chest wall. This one is for the lower lobe, superior lower lobe, in which the patient position is in the supine line and the arms are above the head. Please place your arms above the head. Yes. And there are 2 pillows under the hip, under the abdomen, and this percussion site is below the scapula, either side of the spine, like below the scapula and either side of the spine. Next we move on to the left lateral basal lower lobe, in which the patient is in the right side lying, pillows between the knees, and the head is 30 degree down. The percussion site for this one is on the left lower lateral rib cage, that is over here. This one is the right lateral basal lower lobe, in which the patient position is in the left side lying and there is a pillow between the knees. The head is 30 degree downwards, and the percussion site for this one is on the right lower rib cage.